I am a part of what they call the sandwich generation, which means that I am caring for a 20-year-old daughter and also I'm really privileged to balance that with the caregiving of my parents. I also hear daily from Marylanders who are caring for their own family members, and I know how important the responsibility can be. I share it with each of you as having a mother who is suffering from dementia. My father was her caregiver, and he has most recently turned ill himself. And so it is the case that so many adult children who are balancing work, childcare, and caregiving, it can be a really awesome responsibility.
Today, we are once again talking about an incredibly important issue that affects millions of American seniors and their families, the reauthorization of the Older Americans Act, OAA, and its impact on seniors with age-related conditions like Alzheimer's and Parkinson's. The OAA is one of the most quietly impactful laws this country has ever passed. It's the reason a senior in Naples gets a warm, home-delivered meal through Meals on Wheels. It's the reason a daughter in Pennsylvania can take a few hours of respite after spending the night caring for her father with Alzheimer's. It's the reason a man in West Virginia with Parkinson's can still get to a physical therapy appointment using transportation services. It's the reason senior centers across the country, including New York, can help coordinate with all of these things to support older Americans and their families. These are just a few examples of the faces of this law. When we talk about reauthorization, we're talking about protecting the people who raised us, served our country, built our communities, and now simply need a bit of our support. Across the United States, more than 7 million older Americans are living with Alzheimer's, including more than 580,000 in my home state of Florida. Alzheimer's steals memories and independence, often turning spouses and children into full-time caregivers overnight. Nearly 1 million Americans live with Parkinson's disease, which slowly robs people of movement, balance, and speech, but not of their determination or dignity. Each year, about 90,000 new cases are diagnosed, and behind each one is a family learning to adjust, adapt, and persevere. Behind each of these numbers is a caregiver, a husband, a wife, a son, or a daughter, providing care around the clock. More than 11 million Americans provide unpaid care for people living with Alzheimer's or another dementia. Together, they give 19.2 billion hours of informal assistance valued at $413 billion, and that doesn't even include caregivers for Parkinson's, ALS, or other chronic diseases of aging. These are people holding down jobs, raising children, and still finding time to feed, bathe, and comfort a loved one who depends on them. They do it out of love, and they deserve our support. That is why the Older Americans Act is so vital. It works because it's not a big government approach. It's directing resources to local communities. It's neighbors helping neighbors. In Florida, I've seen the impact firsthand through our area agencies on aging, our senior centers, and the volunteers who deliver meals, install ramps, and check on seniors who live alone. For families living with Alzheimer's, Parkinson's, and other age-related diseases, these programs are not luxuries, they're lifelines. They mean a hot meal, a safe home, a few hours of rest for a caregiver, or a ride that keeps someone connected to their community. When we talk about reauthorizing the Older Americans Act, we are not just debating policy. We are renewing our commitment to America's seniors. A commitment that in the United States, we will stand by our parents and grandparents as they age, and that when disease or disability strikes, families will not have to face it alone. Every service made possible by this law represents compassion made real. That is what governments should do, empower communities to care for one another and let them direct resources to meet their local needs because they understand their communities far better than anyone in Washington, D.C. does. I've said it before and I will say it again. Our seniors have spent their lives building and serving this country, and this bill is one way we ensure they continue to be supported, respected, and valued. I am proud to be leading the reauthorization of the Older Americans Act this year with Ranking Member Gillibrand, helping Committee Chairman Cassidy and Ranking Member Sanders. I urge all of my colleagues to support this important legislation so we can continue to honor, protect, and care for America's seniors and the families who stand beside them each and every day. And now I'd like to recognize Ranking Member Gillibrand for her opening statement.
Just 1 second, I have the wrong remarks. You're American, so I can't see. Okay, here we go. Chairman Scott, thank you for calling today's hearing, and thank you for our witnesses being here. I'm greatly looking forward to our discussion on how our Older Americans Act provides vital, life-sustaining supports to older adults and people with disabilities that allow them to live with dignity and independence in the community of their choice. Many Americans don't realize that the OAA even exists, even though an estimate of 1 in 6 older adults and millions nationwide are helped by OAA funding and programs that they run each year. In 2024 alone, OAA allowed older Americans to receive over 240 million meals at home or in a community setting, over 14 million trips to a doctor, the supermarket, or participate in community events, over 10 million hours of help with everyday tasks like dressing or bathing. The OAA is a bipartisan workhorse program that flies below the radar. It helps fill the gaps and serves as connective tissue that improves the efficiency of federal programs like Medicaid, Medicare, Social Security, SNAP, and LIHEAP. Older adults and people with disabilities want to live and thrive in their communities, and the essential supports administered under OAA allow them to do just that. It's just a bonus that it's also cost efficient. Providing services to the community saves taxpayers billions of dollars every single year that would otherwise pay for extended stays in the hospital or institutional care, like nursing homes, which are far, far, far more expensive. In 2024, OAA funding generated 3.39 times of a return on that investment. This means that every dollar invested in OAA aging services generated $3.39 in community value and taxpayer savings. Furthermore, because of the efficient service delivery, older adults avoided 1.9 million days of long-term hospital stays and institutional care. But now is not the time to take our foot off the gas. Authorization of the Older Americans Act expired last year, even though so far there have been limited interruptions in OAA service delivery because of this lapse. It is vital to pass a reauthorization this fall to modernize the statute and be reflective of the evolving needs of older adults. In June, I was proud to join Chair Scott and our colleagues in introducing a bipartisan Older Americans Act reauthorization of 2025. This bill reflects our bipartisan, bicameral agreement that was included in last December's final appropriations package, which unfortunately ultimately fell apart. Particularly as the aging population is growing at the fastest rate in our nation's history, and more Americans are being diagnosed with aging-related diseases each day, it is crucial to reauthorize this legislation that allows for greater flexibility and increased capacity under the law to meet the need. In today's hearing, our witnesses will highlight how OAA helps families living with aging-related diseases by providing them with a variety of supportive and nutritional services, health promotion programs, and support for family caregivers. However, OAA services are just one essential piece of this puzzle. It helps these families live well in their communities now. Other bipartisan landmark laws, like the National Plan to End Parkinson's Disease and the National Alzheimer's Project Act, that are currently being implemented by HHS, help to chart the path for the future. They represent a federal commitment to changing the trajectory of neurodegenerative diseases that impact millions of American lives. And as we continue this work, it's my top priority to ensure that the voices and the needs of older adults and people with disabilities are elevated in federal policy discussions, particularly about the implementation of key statutes that impact their lives today and for years to come. I look forward to doing this in my role as ranking member of the Aging Committee and the Senate co-chair of the bipartisan Congressional Parkinsons Caucus, and the soon-to-be-formed Americans with Disabilities Caucus. I'll talk to you about later. I will always fight to make sure that older adults and people with disabilities can age with health, dignity, and independence in their homes, in their communities, and in the setting of their choice. I look forward to hearing from our witnesses today and how we can strengthen and administer the OAA to do exactly that.
I want to thank Ranking Member Gillibrand for all of our hard work on all these issues. Now I'd like to welcome our witnesses. Our first witness is Eric Montalegre. Mr. Montelegre is a resident of Broward County, my home state of Florida. Along with his sister, he is a caregiver for his father, who was diagnosed with mild cognitive impairment 4 years ago. He also serves as a trained volunteer Alzheimer's Association community educator and previously served as a long-term care ombudsman. Thank you for being here. You may begin your testimony.
Thank you, Chairman Scott, Ranking Member Gillibrand, and members of the committee. Thank you for the opportunity to testify today. My name is Eric Montelegre, and I live in Broward County, Florida. I'm a family caregiver, a volunteer with the Alzheimer's Association, and a small business owner in the senior care field. I've only been in the field for a short time, about a year and a half, but every day reminds me of just how vital programs supporting older adults are. Not just for families like mine in Florida, but for the nearly 12 million family caregivers nationwide who are caring for someone living with Alzheimer's. Today, I speak to you first and foremost as a son, one of 4 adult children, doing our best to care for our father, Alberto, who is living with stage 3 mild cognitive impairment. I'm proud to have him here today with me. As November is National Family Caregivers Month, it makes today's hearing especially meaningful. Dad was diagnosed with mild cognitive impairment 5 years ago when we first noticed changes in 2019. Initially, he lived on his own, proud of his independence, but over time it became clear that he needed more support, and he moved in with my sister. We soon found ourselves learning, often through trial and error, how to balance his independence with his safety, and how to find resources that would help him stay connected both to his community and to his family. Caregiving, as many of us here know, is emotionally taxing, physically demanding, financially challenging, and it's a full-time responsibility. With the help of our local area agency on aging, we access services under the Older Americans Act, which have made a world of difference to his quality of life. At first, Dad received home-delivered meals, which ensured he had healthy food and provided the reassurance of a daily check-in. He then began attending a local adult day center, which has become the heart of his day-to-day life and in many ways the heart of my story. Dad now participates in many activities that keep him engaged and happy. Like he's learning to play the piano, and he does lots of art. He's able to exercise regularly and safely at the gym that they have on site. He gets to play chess daily, which is something that he's enjoyed throughout his entire life and allows him to remain socially and mentally engaged. He's 84 years old, and since attending the center, he started taking up dancing, which has been a surprise to all of us. It's encouraging to see him enjoying something new at this stage of his life, and it gives us hope in the ability to hold back the progression of the disease. The center provides much more than just recreation. It gives him cognitive stimulation, physical activity, social connection, and dignity. And for my siblings and me, it gives us respite and peace of mind. Knowing that he's in a safe, engaging environment allows us to focus on our own families, our own careers, and without constantly having to worry. I truly believe that the structure, consistency, and connection that the center provides are key reasons why my father's doing as well as he is today. It's allowed me to step back from being his care manager and allows me to spend time with him just being his son. Dad immigrated to the United States from Colombia back in the 1970s. Over the course of the disease, he's lost some of his English and now speaks primarily Spanish. This can make it difficult for us to communicate with him on complicated topics such as retirement benefits and planning. The center employs bilingual trained staff who can speak to him in his native language, helping him and us understand the complicated issues that we need to know to make decisions around his care. It's hard to overstate what a relief it is to have caregivers who truly understand him and speak his language. They can often pick up on like nuances in his speech that even sometimes I miss. Hispanics are 1.5 times more likely to develop Alzheimer's disease, making it all the more important to prioritize high-quality, culturally and linguistically appropriate programs. Programs funded through the Older Americans Act are doing exactly that. They're meeting people where they are and honoring their story. In my culture, caring for our elders is part of who we are, and I hope that my children see that example and carry it forward. Reauthorizing and strengthening the Older Americans Act is an investment in our families, our dignity, and the community. Its programs provide families like ours with structure, valuable resources, support, and hope. Hope that my siblings and I can give Dad the best care possible, and hope that as our country ages, no family will have to walk this journey alone. Thank you again for the opportunity to testify, and I look forward to your questions.
I think we all hope our kids are going to take care of us. So I hope so. All right, now we're going to recognize Senator also Brooks to introduce our next witness.
All right, thank you so much to Chair Scott and Ranking Member Gillibrand. I'm really pleased to introduce our next witness, Steve Sappington, who's a constituent of mine from Harford County, Maryland. Mr. Sappington is a patient advocate who was diagnosed with Parkinson's disease in 2015. Shortly after his diagnosis, Mr. Sappington became involved with Rocksteady Boxing, which provides boxing classes for Parkinson's patients that are specifically designed to help mitigate symptoms. When funding provided through the Older Americans Act for Rocksteady Boxing was in jeopardy, Mr. Sappington became a driving force behind the creation of Rally Against Parkinson's, a nonprofit organization dedicated to protecting this vital exercise, education, and wellness resources for people living with Parkinson's. Mr. Sappington continues to advocate for the reauthorization of the Older Americans Act and the implementation of the National Plan to End Parkinson's Act to better support Marylanders living with Parkinson's disease. So, Mr. Sappington, thank you so much for joining us today to share your story. You may begin your Actually, we're going to go to introduce one more witness?
No, you can, that's good.
Okay, and you can actually begin your testimony now.
Thank you so much. Hello, Chairman Scott, Ranking Member Gillibrand, and members of the committee. Thank you for the invitation to join you today. My name is Steve Sappington. I'm 73 years old. I'm married to my wife, Dee, for 51 years, and I was diagnosed with Parkinson's disease in 2015. We have 5 sons and 9 grandchildren who keep us busy and motivated. For over 3 years before my diagnosis, my wife and I noticed a number of changes in my behavior. I was taking tiny steps instead of long strides. My once clear handwriting became illegible. We went to Longwood Gardens and I suddenly couldn't smell the thousands of blooming flowers. My hands began to shake. My balance was deteriorating. I had no idea what Parkinson's disease was. Dee urged me to see our family physician, who referred me to a neurologist. That's when I was diagnosed in 2015. I was upset and frankly in denial. No one in my family had ever had Parkinson's disease. At that time, Dee had a close friend who also had Parkinson's, and she and a friend were attending a class called Rocksteady Boxing. And these classes, and they kept telling me for weeks how great they were. I wanted nothing to do with it at the time. Why would I want to go to a boxing class? I was still angry and ignoring the obvious, and I guess going to a class would mean I had to recognize I did indeed have PD. Eventually, I gave in, mostly to get them off my back. But I went to observe a class, secretly determined to hate it. Instead, I found it interesting and even fun. Everyone was friendly and welcoming. All had Parkinson's at different progressions, and they were doing exercise specifically designed to counter the symptoms of the disease. I started going to 3 hour-long classes 4 to 6 times a week. 3 hour-long classes 4 to 6 times a week, and noticed small but immediate results. I faithfully went for 18 months, and then I heard that the funding for these classes was in jeopardy. After talking with the gym owner and certified trainers, I realized I couldn't let the classes stop due to lack of funding. More than over 200 older adults with Parkinson's, people like me, were benefiting from these free classes. I decided to start a nonprofit to raise money to keep them going. In 2018, I launched a nonprofit called Rally Against Parkinson's, or RAP. To make that happen, we were all volunteers, mostly seniors living with Parkinson's and some friends, learning as we went. With help from community grants, as in Older Americans Act and our own fundraising, we were able to secure enough funds to cover costs and keep every class free. That support made it possible for hundreds of people with Parkinson's to keep exercising, connecting, and improving their health. Today, our program offers 10 free hour-long classes each week. It's been life-changing for so many. Programs like this need secure, long-term funding. My neurologist tells me that my Parkinson's symptoms have remained unusually steady, saying it has never happened before in decades of her practice, and dubbing it a miracle. I went 8 years without needing to increase my medication, something very rare in a progressive neurodegenerative disease like Parkinson's. I believe the exercise and community programs like Rocksteady Boxing are a big reason why. When I first heard my diagnosis, it rocked my world. I didn't know what my future would hold. My balance and energy were fading. I was skeptical of the boxing class originally, but I went. That single decision changed my life. That is why the Older Americans Act matters. Programs that provide transportation, home-delivered meals, caregiver support, and community services make it possible for people like me to get to classes that improve mobility, reduce isolation, and help caregivers continue their vital work. I and many from Rock City Boxing Class attend monthly Parkinsons support group meetings, and caregivers attend the Caregiver Support Group monthly meetings, all funded by the OAA. Thank you. These services don't cure Parkinson's. There still is no cure. But they keep us moving, participated, and connected while these researchers work towards better treatments. My ask is simple. Please reauthorize and fund the Older Americans Act this year with strong support for Title III services, nutrition programs, transportation, and caregiver support. These investments help people with Parkinson's and millions of other older adults stay in their homes and communities keep moving and stay connected. I also ask on behalf of the Parkinson's community that you support robust federal funding for PD research and ensure the implementation of the National Parkinson's Project Act and a seated advisory council. These efforts are important pathways to a cure. Thank you for the opportunity to share my story. I'll be submitting a full written statement and look forward to any questions that you may have. Thank you so much.
Thanks for being here. I look forward to hearing about the boxing. Okay, Senator Husted, if you'll do our next witness.
Thank you, Mr. Chairman. And thank you. I'd like to introduce an Ohioan, Duana Patton. Welcome to the committee. Ms. Patton serves as the president of USA Aging, a national organization representing the nation's 600-plus area agencies on aging. In this role, she leads efforts to strengthen and modernize the Older Americans Act and ensure that community-based programs like home-delivered meals, transportation, caregiver support, and in-home assistance remain accessible to older adults and their families. Additionally, Ms. Patton serves as the CEO of Ohio District 5 Area Agency on Aging, where she has worked to expand access to dementia-friendly services, improving workforce training, and promoting partnerships across health and aging sectors. Ms. Patton, thank you for joining us today, and please begin your testimony.
Sorry. Chairman Scott, Ranking Member Gillibrand, and members of the committee, thank you for the opportunity to speak before you today. My name is Duana Patton, and I am honored to serve as the CEO of Ohio District 5 Area Agency on Aging, where I have worked for nearly 31 years. Our agency, located in Ontario, Richland County, Ohio, is one of 613 area agencies on aging, or AAAs, located across the nation that helps older adults remain independent and supported in their communities. I am also the board president of US Aging, the National Association of AAAs. On behalf of these agencies and the millions of older adults and family caregivers we serve, I want to express my gratitude for your continued commitment to improving and prioritizing the Older Americans Act. As the older adult population in the United States continues to rise rapidly, AAAs have seen increased demand for OAA programs and services across the country. Strengthening the OAA, which is administered by the Administration for Community Living, over the next decade will be critical, as it is the cornerstone of the nation's non-Medicaid home and community-based services, serving nearly 11 million older Americans per year. The Aging Network carries out these services and includes state units on aging, Title VI Native American aging programs, and tens of thousands of local service providers. The OAA enables the local delivery of home and community-based services, which are almost always less expensive than institutional care provided in nursing homes or assisted living facilities. The longer older adults can successfully age at home, the better it is financially for families and the federal government. For over 50 years, AAAs have served as the local leaders on aging. We are social care experts and often the front door to aging services, receiving referrals from caregivers, physicians, and community partners, usually at a time when a person is facing a new or increasing risk related to aging. The core services we provide include nutrition, supportive services, caregiver support, health and wellness, and elder rights. Our person-centered approach recognizes the health of the person and focuses on interventions that will foster better outcomes. A good example of that is Miss Gray. Miss Gray was referred to our AAA following a hospital stay for a chronic health condition. She was not complying with her medication regimen and had poor eating habits. By providing personal care in her home weekly and home-delivered meals, Miss Gray has improved health, both physically and mentally, and has not been admitted to the hospital since she started receiving these services. This is a powerful impact of the Older Americans Act. There are several OAA programs that provide critical support to older adults with age-related diseases. First is the Older Americans Act Title IIIB Supportive Services, the bedrock of the Act, and a lifeline for older adults needing in-home support. Then we have OAA Title III Nutrition Services Program, the largest program in the country that provides nutrition services to older adults in need. Additionally, OAA Title IIID Evidence-Based Health Promotion and Disease Prevention Programs support falls prevention and health management for older adults. And Title IIIE, the National Family Caregiver Support Program, supports the family caregivers of older adults. Lastly, authorization of the OAA expired last year, and since the last reauthorization in 2020, AAAs have identified new opportunities to be even more responsive to the evolving needs of older adults. In closing, the lessons we learned during the pandemic underscore the importance of allowing AAAs to continue using innovative practices that have proven effective. The timing of this reauthorization is ideal. It gives us the opportunity to strengthen what works, modernize where needed, and ensure the Act continues to meet the needs of older adults, caregivers, and communities across the nation. Chairman Scott, Ranking Member Gillibrand, and members of the committee, thank you for the privilege to share my passion and stories from the field. This day for me is particularly meaningful, not only because it marks my mother's 82nd birthday, but also because this opportunity stands as a cornerstone moment in my career dedicated to serving older adults like my mom.
Thanks. Thank each of you. You have great stories of the importance of the OAA. Now we're going to go to questions. Senator McCormick, would you like to go first?
Thank you. Thank you all. Thank you, Mr. Chairman. Thank you, Ranking Member. Thank you all for taking time to speak with us today. You bring such important perspectives, and this is something that we're very focused on in Pennsylvania with our aging population. Mr. Sappington, you have a unique perspective as both a patient and an advocate for Parkinson's disease patients and caregivers. How does the support you get from your community and volunteers complement federally supported programs like those covered under the Older Americans Act?
Volunteerism is the center of everything. We wouldn't have anything if it weren't for volunteers and people that were working. I hope I'm answering your question properly, but I think it works in concert with those benefits provided by the OAA, because the OAA provides many services such as transportation and nutrition and many other services. And I think without the people, the caregivers and the volunteers support them, you wouldn't be able to have all that. In other words, it wouldn't happen without they're synergistic, I guess. So from my vantage point, all of these have been very beneficial for all of us. We would not be able to sustain the program that we have at all without that being the case, without the OA providing transportation and without providing some of the programs that they have. I know that the support group meetings that I go to were funded by the OAA, and so that's something that's been vital for us to get information and get the word out to other people. That through our volunteers, we were able to get large people that gathered for these meetings and get the word out about our programs that we offered. So again, they kind of go hand in hand. I hope that helps.
Yes, it does. Thank you. We have more than 300,000 Pennsylvanians that suffer from Alzheimer's, and nearly 50,000 Parkinson's patients live in our Commonwealth. And these numbers don't capture the hundreds of thousands of caregivers who volunteer their time and resources after to support their loved ones. Mr. Monteligre, I hope I got that right. Your firsthand experience with your father and so many others in your community is extremely valuable. You've touched on several services supported by the Older Americans Act. What do you think's missing in the programs covered under the OAA that would go a long way towards supporting Americans with these neurodegenerative diseases?
Thank you for the question. I think one of the most important things is time. And the sooner that the family caregivers can learn what services there are at the diagnosis point. A lot of families get diagnosed, they get told, and they get appointments with social workers who can give them a multitude of options. And the family needs to understand that the sooner they can get their loved ones into treatment and therapy, the sooner they can start pushing back on these diseases that do not have cures. And I think a lot of times there's a slight delay between diagnosis and the start of community resource interventions. And if there's anything we could do to shorten that time or limit that time, it would make an impact in everybody's lives.
Thank you very much. Thank you, Mr. Chairman.
Thank you, Senator Also Brooks.
Thank you so much to Mr. Chair and Ranking Member Gillibrand. Like so many of my colleagues, I am a part of what they call the sandwich generation, which means that I am caring for a 20-year-old daughter and also really privileged to balance that with the caregiving of my parents. I also hear daily from Marylanders who are caring for their own family members, and I know how important the responsibility can be. I share it with each of you as having a mother who is suffering from dementia. My father was her caregiver, and he has most recently turned ill himself. And so it is the case that so many adult children who are balancing work, childcare, and caregiving, it can be a really awesome responsibility. And we know that a shutdown causes so much fear and turmoil for so many people who are just wondering what tomorrow will look like. Now, the Older Americans Act exists to bridge the gap for caregivers, to ensure that older adults can live independently and with dignity, and to support the families who care for them. Last year, Congress got to the 5-yard line on a bipartisan reauthorization of this critical law before a tweet by Elon Musk undermined the progress. And so at the very same time that families are being requested to do more with less, we know that this administration has moved to dissolve the Administration for Community Living, weakening the agency responsible for coordinating the support nationwide. Our responsibility is clear. We must reauthorize and strengthen the Older Americans Act and ensure the programs and agencies that carry it out have the staffing and stability needed to meet rising need, especially during a shutdown that, in my opinion, has gone on too long. So I look forward to hearing from each of you today and discussing how we can protect and strengthen the systems that our seniors depend on so that they and their caregivers are supported and not left behind. The first question for Ms. Patton or Mr. Monteligre is about the ACO cuts and shutdown. The Administration for Community Living is the backbone of the Older Americans Act. It keeps the nation aging network coordinated and functioning. But over the past year, we've seen sweeping staffing reductions along with a proposal to dissolve the agency altogether and fold its functions into a larger, less specialized division at the Department of Health and Human Services. Now, layered on top of these cuts, we're in 36 days into a shutdown that has frozen or delayed essential work across the agency. Ms. Patton, what does it mean for families and caregivers when the ACO loses staff, loses structure, and is unable to operate its Older Americans Act programs?
So thank you for the question. I think that's where the Older Americans Act, where we see its greatest strength, is because it does start at the federal level through state units on aging all the way down to the local level. And, during the pandemic, the AAAs, we were required to be very nimble and to come up with ways in which during trying times or challenging times, whatever the reason, to make sure that individuals and families had the services and supports that they need. So when we think about the Older Americans Act and the way it is designed and the importance of the reauthorization, it's making sure that no matter what is happening around us, that we have the ability to serve the people in our communities, to take care of the individuals in a timely way, and to think about caregivers. And so, that is the value of the Older Americans Act, is because there is this federal perspective and the authority to administer the Older Americans Act, but then it works its way all the way down to the local level where we can be innovative and responsive to the needs of individuals.
Thank you. Now, Mr. Sappington, first of all, I want to thank you for being here today and for the work that you've done in Maryland and keeping our community exercised and moving in programs like the one that you've been involved in. And your testimony, I think, underscores something really important about the Older Americans Act, and it's how it helps people to live well today and also helps people to have hope for tomorrow. As someone who's living with Parkinson's, you know personally what it means to rely on the day-to-day support for long-term search for better treatments. So I want to ask you, how do the services that the Older Americans Act supports, like transportation, caregiver resources, and community exercise programs, help people with Parkinson's maintain function, stay connected, and live well day to day?
Thank you for the question. I'll try to do my best to answer that. The OAA provides vital support in terms of the transportation and the caregiver support that people with Parkinson's desperately need. And the fact that it is a federal program and obviously needs to be supported and reauthorized to prevent any disruptions in access to critical supports like home care, transportation, or caregiver assistance. I'm also going to say that the National Plan to End Parkinson's Act would be something that would go hand in hand with the OAA because the OAA provides what people need now, the services they need to get from point A to point B to be connected and to continue to stay active, and as well as the nutrition and the caregiver support. So the OAA is vital to people with Parkinson's and those that have neurodegenerative diseases in our older population. They both go hand in hand with the National Plan to End Parkinson's Act. And one is basically providing people what they need now to live with their older Americans, to live with their neurodegenerative diseases. And the other looks for a permanent end to those diseases. So they kind of work hand in hand. One's the now cause, one's the future cure for it. So I can't say enough about the need for both.
Thank you.
Thank you very much for that question.
Thank you so much.
Ranking Member Gillibrand and I would love it if everybody on the committee would co-sponsor the reauthorization of the OA. Let me turn it over to Senator Moody.
Thank you so much, Chairman Scott and Ranking Member Gillibrand. Thank you for holding this important hearing on a very important topic. Let me welcome my fellow Floridian from Broward County, Eric Montealegre. Appreciate you being here. Thank you so much. And to all of our witnesses today, this is so important. And these hearings help us not only highlight how certain policies help Americans, the challenges that we might face in getting policies pushed through Congress. And this is all part of that process and such an important part. And we appreciate you taking part in today's hearing. I was raised by a mom who dedicated her entire career to helping seniors, aging Americans, working with the groups that are supported through the Older Americans Act. And it's probably no surprise when I became Florida's Attorney General, one of the first things I did was set up a senior protection team, which was an interagency team to focus on how we can better serve aging Americans. As you know, we are the Sunshine State in Florida, but we are also the Silver State, I like to say. And so it was so important. And I want to thank the attorneys that worked with me and the investigators that worked with me. They did so much to protect seniors in our state. But I think one of the things that gets lost in this piece of legislation is that it authorizes grants for long-term care ombudsman program and specifically the elder abuse, neglect, and exploitation prevention programs. And I know that we have people here a volunteer now with Alzheimer's Association, but previously, I believe, sir, you served as a long-term care ombudsman, and I know, Ms. Patton, you as well. And I would just like to talk to you because so many of these programs, and not just those that are specifically designed to prevent or hold people accountable for abuse and exploitation, but also the programs like Meals on Wheels and other programs where we have interaction with our aging population so that we can better identify those seniors that may be in need. I'd just like to hear from you how important those programs are to our aging population based on your own personal experience. And we'll start with you, Mr. Montalegre.
Thank you, Senator Moody. So I like to think of the Ombudsman program less of a compliance program and more of like a cooperation program. Residents oftentimes have needs that they can have trouble expressing, or maybe don't know who to express those needs to, and the Ombudsman would uncover those needs through asking, through developing relationships, and then bring those needs to the management of a facility to try to resolve, or to maybe just bring that to awareness. Most of the time when I was in the program, that was exactly the case. It was a need that was not being addressed because there was no awareness. And that was like some of the best work that I could do.
Are there any tweaks that you think need to be made to the legislation? Probably in many instances, once you made them aware, that was remedied and we were providing better care. But do you think there need to be any tweaks in the legislation to provide better coordination with law enforcement when these instances might be identified?
Well, the ombudsmen are required reporters, and there is a process in place to, at least in Florida, there's a process in place to report that to the correct authorities when needed, immediately if needed so. So I'm not sure about legislation, but I would say that I think there's an education piece that needs to be done at the community level so that the residents are aware of their rights and aware of what we can do to benefit them. So many times I would say to somebody, "Hi, I'm your ombudsman," and they're like, "What?" And once they understand what my responsibility was and my role was in supporting them, they would open up. And I think that's just a lack of clarity to the population.
And I'll ask you, Ms. Patton, same questions.
Thank you. Great question. And from our perspective in Ohio at our AAA, we actually administer and sponsor the Ombudsman program, so I'm very familiar with that. And also in parts of our region, we administer the Adult Protective Service program. And I think one of the amazing things is that the Older Americans Act allows AAAs to be the front door. So a lot of times people are coming into a AAA at the front door needing information and assistance or a referral somewhere. And through the process of, talking with them and building this trust, we often learn about things that are going on in their lives that maybe they might not open up to, that are very appropriate for a referral to an ombudsman program or to an adult protective services program. A lot of times people do find themselves in situations and they don't even realize that they have rights or that they might be being exploited. So the fact that the Older Americans Act exists and area agencies are across the country working with ombudsman programs, whether they sponsor it or it's somewhere else in their community, or adult protective services or law enforcement, the fact that AAAs are boots on the ground in their community, we like to think that those collaborations happen. And, I think when we think about the reauthorization of the Older Americans Act and the fact that we want to embark more flexibilities, that there can be more of that, more collaboration at the local level to protect individuals.
Thank you, Mr. Chairman.
Thank you, Senator Moody. Senator Kim.
Thank you, Chairman. Ms. Patton, I actually just wanted to build off of what you were just talking about there. You noted the area agencies on aging are often front doors for families navigating aging-related challenges. I guess I want to ask you, how can we strengthen coordination across the local, the state, and the federal levels to make it easier for older adults and caregivers to access the full range of support that they need?
So I think that part of that comes with, awareness of what AAAs can do and do in their communities, talking about it. And I love the stories that the gentlemen have shared here with me today, is that when there is this awareness and there is conversations about things that are sometimes a little difficult to talk about, it builds that collaboration. And when the Aging Network, AAAs, other partner agencies can be at the table and talk about policies, talk about funding, talk about challenges that exist, then great programs and innovative ideas come to be.
Because you're saying they're where the rubber hits the road, and as a result, the insights that they can be able to provide can just really encourage that kind of creative, innovative thinking. Is that right?
Absolutely. And I think AAAs, throughout many, many years have been innovators. The Act has allowed us to do that.
Yeah. When we kind of zoom out a little bit, I guess I just wanted to get a sense of your kind of overarching priorities. Do you have ideas of what are some of the most critical priorities that Congress should consider as we are working to reauthorize the OAA, to be able to ensure that the programs are meeting the needs of today?
Okay. And I think it would be real easy for folks to talk about funding. But when we talk about the Older Americans Act and the way that it exists and its purpose is to make sure that there is this local perspective, that local organizations can work together to determine what the needs are in their local communities, and that there is flexibility to ensure that maybe the way that somebody needs a home-delivered meal in one part of the region or country is not necessarily the same way somebody needs it in another part of the country.
I appreciate that. Mr. Montealegre, I guess there's something there that I felt like kind of connected with things that you have talked about when you've highlighted the importance of culturally and linguistically appropriate care. How can the OAA programs better ensure that caregivers and older adults from diverse communities have equitable access to this kind of support?
Well, I think it's important to understand that as people progress through the disease, very often they start learning languages. Start losing languages, but then revert to original native languages. So it's important to us to understand, where our community came from, so that we can train and bring in the right people with the right skill set to support those people who have, for one reason or another, lost the ability to speak English. That would keep them engaged with therapies and with community resources that will help them stave off the progression of the disease.
Yeah. I appreciate that, and it's something that I've been grappling with myself. My father is somebody who's been declining quite rapidly over the last year, and actually just a couple weeks ago, we got the formal diagnosis of Alzheimer's for him. He is somebody that has lost the faculty to speak English, has reverted back to Korean. He doesn't actually realize he's not speaking English. He thinks he is. But it's been very difficult. There are very few places where we can get care, caregivers, and get that kind of support in Korean. And it's been just very challenging to be able to do so in a way that I feel like he's taken care of while I'm here at the Capitol. So, I agree with you wholeheartedly on that front, that we need to be pushing on that. I mean, look, just as we're talking through this, Chairman, I'm grateful that you brought this up, because again, I really do think, and we've talked about this before, this is a unifying issue. This is something that all of us understand as part of the human condition in terms of what our families are going through. And at a time when we're certainly having deadlocks and challenges and other types of policy debates, I do hope that our ability to draw upon just the struggles that so many families are facing when it comes to aging-related challenges. I know, as I said, we've kind of plunged into the deep end as a family, and it's been overwhelming for us. It's been a very difficult last year. Things that I never realized that we would have to confront, and to do so while I'm also raising an 8-year-old and a 10-year-old. It's been a lot. And so, this isn't just academic to me or theoretical to me, and I'm grateful for you all coming on out here, talking to us about this, and you have my word that we'll do everything we can here to try to push forward on the reauthorization and do it in a way that can provide help to so many Americans. So with that, I'll yield back, Chairman.
Thank you, Senator Kim. Senator Husted.
Thank you, Mr. Chairman. Thanks to the ranking member and you for hosting this hearing today. In preparation for this hearing, I was doing a little research and I saw that this problem of isolation, loneliness is getting worse. It did hit perhaps a peak during the COVID pandemic, but as a trend, it's getting worse. And I saw the report that said people between the ages of 50 and 80 reported feeling lonely and isolated. 1 in 3 people found themselves in that situation. And that loneliness and isolation is associated with an additional $6.7 billion in Medicare spending. And if we can do better at limiting the loneliness and isolation, we get better health outcomes. People's cognitive decline is maintained for a longer period in their life, and the better, higher quality of life, which is also important. Longevity, but also quality of life is a big deal. And I know that in doing some of the research, you see that, look, it's, I know my parents are 86 and 87. They have each other, and they have my brother and sister who live very near them. So they have that family structure that helps a lot. It helps a lot, but I know a lot of people don't have that. Our society, for a variety of reasons in terms of family formation, the number of children, people having the mobility, and people living all around the country or all around the world, children, meaning their adult children, makes it harder on them. And so I'll start with my Ohioan, Ms. Patton. What have you seen over the years in these trends, and not just as a matter of policy, but as a society? How can we do better?
Okay. Well, I think certainly through the pandemic, social isolation really came, to be. We started talking about it. And a lot of those statistics, we're very aware of those. I think that what we need to make sure that we're doing is not just saying that someone's socially isolated, but meeting them where they are. And I think the gentleman over here talked about the fact that he was able to go to a senior center and didn't realize the value that would bring. I like to tell the story real quickly, if I could. We had a gentleman during the pandemic that could not go to the grocery store, was afraid to go out in public, but we had grab-and-go meals. And so he came to the agency, picked up a grab-and-go meal, and, had a nutrition, better nutrition. He was diabetic. He was living on Pop-Tarts and hot dogs. That's what he was eating because that's what he could fix. But after he began getting the grab-and-go meals, he lost weight and his diabetic medication was reduced. In addition, he made friends because we made the grab-and-go meal experience something in which the individuals engaged with our staff and engaged with each other. Today, that very same gentleman is coming to the congregate meal site and is healthier, happier, and certainly more engaged with the community. So I think what we have to do is we have to be creative, and we have to think about what makes someone socially isolated and what would help them become more engaged in their community. It might not be going to a senior center or a meal program. It might be that they become one of those volunteers in an innovative program that a AAA has created where they pick up the phone and they're calling somebody else. It can be that simple.
Yeah, and how is it? I mean, I know that every agency on aging is different. They're run by different. This is an administration. It's an innovation. What are some of the examples or best practices that you've seen used to create that engagement?
So one of the great examples is the phone a friend, where seniors are engaged in telephone calls back and forth with each other. We have leveraged schools in our communities where we invite them to participate with us to have intergenerational programs where we can provide the transportation for a senior to get to the school and maybe read to a student. In addition, a lot of the Older Americans Act programs bring people into the home because people are remaining in the community versus in an institutional setting. And so by working with meal providers, personal care providers, and people that are in the home, making sure that they're building a relationship with the individual. Maybe sometimes they're bringing puzzles or books or things for people to do so that they can be more engaged, whether they're at home or in the community.
Great. Thank you. Thank you, Mr. Chairman.
Ranking Member Gillibrand.
Thank you, Mr. Chairman. So I wanted to ask a little bit about how the OAA connects older adults to multiple social services, sort of a general experience from you, Eric and Stephen, and maybe from you, Ms. Patton. You can tell me how it actually fits together. But things like Medicaid, SNAP, HEAP, that our older Americans rely on. And how does this serve as an umbrella for organizational structure for delivery of critical services? And in particular, how does it affect rural Americans? Because 1 in 5 of our older adults are in rural America. Ms. Patton.
Thank you for the question. So the Older Americans Act, as the umbrella of many services, allows us to connect people to the services that you had mentioned, Medicaid and SNAP. A lot of times we will work with individuals in our agencies that come to the front door or that are participating in a program, and we want to make sure that they're connected to the resources that are available to them, whether it is SNAP or Medicaid. But one of the things that we also do is we are, in many cases, a Medicaid diversion. So trying to use the lowest cost intervention that is possible, the funding sources, the programs that exist, and then connecting them to these services at the right time when they need them. But a really good example of SNAP is an individual that gets SNAP but doesn't have transportation is not going to be able to leverage those. So we have actually, in our network, been able to leverage the Older Americans Act services and help people connect and use the services that they may be eligible for.
Understood. Stephen or Eric, do you have any anecdotes about how it's worked for you?
I'll go next. So here in Broward, the agency serves as like she mentioned, an umbrella organization. But then they also are an experimental organization as well, where they're reaching out to technology companies, for example, like robot puppies or robot cats, to help people deal with isolation and feelings of loneliness, and as well as like radar for alert monitoring devices, things like that. So these are things that I wasn't even aware of that existed or even needed. And I think the agency is constantly looking for other things that can help. And then they vet those programs or products or resources. So going to the agency gives us a sense of confidence that there's all these different things, and maybe these things work for us or not, but what we feel is they're safe to try and they're safe to go talk to without possibly having our family members fall into some kind of bad situation or some kind of trap. And that certainty makes it easy for us to reach out to them and say, hey, you're a safe source. So so the other organizations also funnel themselves automatically to the area agencies on aging, because they know that if they can get the agency's buy-in and support, that the population, the community will reach out to them for help as well.
Understood. Stephen?
Yes, I would like to say that grassroots programs are often the closest to the need, and they see firsthand what helps older adults and people living with these cognitive diseases stay healthy and engaged. Increasing the funding for the area agencies on aging so that they can partner with and support innovative community-based nonprofits. Area agencies on aging can also offer technical support and guidance to older adults who want to start local programs but may lack the experience or resources. And transportation is also, on the OAA, transportation is also often the biggest barrier for keeping older adults and people with Parkinson's and other neurodegenerative diseases.
Have you used any of those transportation services?
Yes, I have.
And give us an example of where it made a difference for you.
We've had, well, personally speaking, we've had, I got a call from a gentleman that had just been diagnosed with Parkinson's. He thought it was the end of the world. His parents had died. His girlfriend had just broken up with him. He went to the doc and was diagnosed, and he came back in, ironically enough, infomercial was on, and I had reached out to some people in the media and was doing a thing on Parkinson's and how to fight back against that. And he thought his world was coming to an end and saw me giving my phone number, and I got a call from him. I spent the next 2.5 hours walking him off the edge.
Yes.
And I ended up meeting with him halfway. He was 20. He was in Baltimore City. I was up around the Pennsylvania line. And anyway, we ended up meeting halfway, and I hooked him up with a way to get from down 20 miles away from where he was to a rock steady boxing class that he would be able to
Oh, that's great.
take advantage of that. So that worked out very well. So thank you for that.
Thank you. Go ahead.
Mr. Staten, tell me about your boxing. What do you do?
It's fun. Well, first of all, I want to go back and say I did tell all the gals that were trying to get me to go that they were right.
Yeah.
And
It's always better.
yeah, yes, it is. You recognize that sooner is always better than later. But they play music, and everything they do is designed to combat a symptom of Parkinson's. And Parkinson's is one of those things where you have, your brain and interferes with your muscles' ability to respond, and your body. That's why they get the dyskinesia and the shakes, and your body not behaving the way that it should. First of all, they play rock music of our generation, which gets you involved with it, so you're there from a musical standpoint. That's wonderful. And then they give you short commands where you have to use your brain and your mind to stay active. Like you're going to throw X amount of combinations of punches into heavy bags, or they have ladders painted on the floor, and you have to step in and step out of them. Much the way you see football players do between tires. Ours are not between tires because we'd be falling all over the place. So these are just painted on the floor, and you have to use your footwork, and you have to have strengthen your brain to tell your muscles what to do. And if you keep doing that, the muscle memory becomes very strong, and it can override some of the symptoms. And that's wonderful. Even Parkinson's even takes away your voice. And my voice used to not very often be this soft, but even with the commands that they give, you're supposed to holler back.
Yeah.
So the more you exercise it, the more you can strengthen your voice. So it works out very well. So
you don't have to box a person.
no, that was one of the things that I've harbored under when I first heard it. Why would I want to go boxing, But
I already have a problem. I don't need another one.
right. No, but I appreciate the question. That exactly where I was, at least from my standpoint. So thank you.
Thanks. Mr. Montalegre, how did you find these services? How did you even find out about them?
Not fast enough, to be perfectly honest. We started, using internet searches to try to see what options there were, and I think that's where we started getting confused. I think if you put in, dementia, any of those kind of searches, tons of things come up. And after having gone through several rounds of talking to the wrong people, I found the right people, and they were able to get us in to take classes for us so that we could understand what was going on, so we could learn about what dementia progression looks like, what some symptoms are that might happen, what adaptations we can make to help our family members. It's that kind of education that really gave us the confidence to keep looking. Because at that point, we don't even know what we don't know. So when you don't know what you don't know what to look for. But being in those classes, it tells you this is what you need to look for. This is what you need to look for. And it's really developing like a new vocabulary for things that we had never heard of before. So,
Ms. Patton, can you tell me, do you have any other stories you want to tell us about how you've changed people's lives?
Thank you for asking. So I've been very inspired by both of the other witnesses here today and the questions that have come from the committee. I think that what I'd really like to just share is the things that we've just talked about here. This discussion has inspired me to think about the value of the Older Americans Act, the value of conversations like this with people that can tell stories and that can make a difference in policy and in practices. It saddens me when Eric says that he didn't get the information fast enough. And, I think that, through the Older Americans Act and the innovative approaches for AAAs, and when we think about the programs that we have, I'm thinking about 3D and the evidence-based programs is where we're touching individuals and how invaluable it is that we're meeting people before they're in crisis, that we're leveraging the funds and the programs under the Older Americans Act to get to families, caregivers, and individuals before the crisis.
Do you think you both help people and you save money?
Absolutely. We help people and we save money. And the sooner that we do that and the more innovative we can be, yes.
Have you helped people either stay active in their job or stay active in their volunteering?
Yes, through the area agency and through the Older Americans Act transportation services, through the ability to work collaboratively with other organizations. We have many individuals that come and volunteer in our meal sites that might not otherwise get out.
So for any of you, is there any reason at all you think we shouldn't reauthorize the OAA? Is there any, in your wildest imaginations, can you imagine why we wouldn't do that? No. It's pretty simple, isn't it? So, well, on behalf of the ranking member, I just want to thank you guys for coming here. I want to thank you for your testimony. I think that having a hearing like this gives us an opportunity to give, hopefully inspire all of our colleagues to focus on this and get this done as quickly as possible. I'd like to thank everyone for being here today and participating. I look forward to working with members across the aisle and down the dais. If any senator has additional questions for the witnesses or statements to be added, the hearing record will be open until next Wednesday at 5 p.m. Thank you guys for coming.